Good afternoon, everyone. This afternoon we'll be taking a look at the reports for the tonsillectomy episode. PAPS will be provided tools to help measure and improve patient care. One of the most important tools is the provider report. These reports are key to keeping up with your performance relative to each episode and show your eligibility for gain risk sharing. The reports provide performance information for PAPS episodes, such as an overview of quality across a PAPS episode, overview of cost effectiveness, in other words, how a PAP is doing relative to cost thresholds and relative to other providers, and an overview of utilization and drivers of a PAPS average episode of cost. PAP performance reports have summary results and detailed analysis of episode costs, quality, and utilization, and a guide to reading your reports is available online. Shelley will provide the information at the end of the webinar for the online portal. Reports are also available online via the provider portal. So you can go into the provider portal to gain access to reports. Reports are issued quarterly. There is a delay between the reporting period and the availability of reports on the provider portal, and that is due to the time required for claims to be submitted for services provided. 3 months for 95% of the claims, and the time required for the claims algorithm and quarterly reports to be processed, and that's usually 1 month. Now let's look at the reports. The first page of the report will give you the date of the report and the date range of the data included in the report. It will also tell you if it is a historical report or an actual performance report. Please note the disclaimer at the bottom of the page, which states the information contained in these reports is intended solely for use in the administration of the Medicaid program. The data in the reports is neither intended nor suitable for other uses, including the selection of a healthcare provider. The figures in this report are preliminary and are subject to revision, and for more information, it gives you our website, paymentinitiative.org. The second page that you'll see is a letter from Andy Allison, our Medicaid director. There's a lot of useful information in this letter regarding the Arkansas Payment Improvement Initiative, so I encourage everyone to read the letter. One section of the letter that I would like to bring your attention is in the 4th paragraph. In the first sentence, he'll tell you whether this report is in the preparatory phase or historical or in the performance phase. I realize that you're starting to view many of these reports, and sometimes it is a little hard to keep them straight. So this is another way that you can be sure that what you're looking at is historical or actual live performance data. The next page of the report is the table of contents. This is going to list all episodes in which you are considered a PAP. So it could be that you just have 1 or 2 episodes listed here, maybe just 1, but any episode in which you are considered a principal account provider will be listed here. The next page is the performance summary. This is a little different from our initial report, but I think it's a lot better and a lot easier for you to read. It will list the episodes in which you are a PAP. Here we have listed all our active episodes for right now, but it will only list those in which you are considered a principal account provider. It'll show you the episode of care and whether or not you have met the quality metrics. It says quality of service column. It will tell you met or not met on the quality metrics. The next column will tell you whether your average episode cost is acceptable, non-acceptable, or in the commendable range. The next column will show if you are eligible for gain or risk share. And the last column will show the share amount. If you will look at the last line of the report, it will give you a summary of your gain and risk share and tell you whether or not you are subject to risk sharing. And it will also tell you if stop loss was applied. Now, stop loss is the cap that they have provisioned in, and the cap of 10% over your Medicaid earnings for that period. So that's real important, because if you will look on this example, the risk share was initially $3,844, and when the stop loss was applied, it was only $3,000. The next slide is the summary page. I think this is one of the most important pages of the report. It'll give you, at a glance, kind of where you stand, whether on quality and cost. The first section is the overview. It'll give you the total number of episodes, and if you'll see in this example, it was 262. But it says the total episodes included was only 233. So you had 29 episodes that were not included, that were excluded for any number of reasons. It could have been age, it could have been a comorbidity, but there are a number of reasons that those were excluded. So not all the episodes were included in this report. The second section gives you the cost compared to other providers. This provider is in the little darker blue diamond. As you see, they're in the acceptable level, and it notes where all other providers are, so you can see where you are relative to other providers. In the block to the right, it'll tell you whether you are gain or risk share. You'll see that this provider is in the acceptable range, so there is no gain or risk share. The third section is the quality section. On the first side of the black line, it will list any quality metrics that are linked to gain sharing. Because this is an historical report, it doesn't have any on here. But when you get your performance report, it will have a bar graph similar to the other side, which will show you where you are as far as quality metrics for this episode. And I believe with this episode, it is with the steroid use post-operative. The second side of the black line will show you metrics that we are tracking but are not linked to gain share. And you can see where you stand, you and the average. The fourth section of this has three graphs in it for your cost summary. The first one gives you a total cost overview with your adjusted and non-adjusted costs. This next one right beside it will give you the average cost overview between you and all other providers. Remember, we are looking at the average cost, so you see where you stand with the other providers. The next graph in the middle will tell you how your beneficiaries fall into this. So for your episodes, if you will look right here, you'll have 23 beneficiaries that fell between the $899 and the $974 range. That was in the commendable level. By the same token, in the not acceptable level, there were 23 beneficiaries that fell between the $1,003 and $1,542 range. And then you had 84 beneficiaries that fell in the acceptable range. So when you're looking at this graph, and if you see a large number of beneficiaries that may fall into that non-acceptable range, you might need to look on the detail part of the report and see if you can kind of pick out those beneficiaries that may have fallen in that, and see if there's where those costs lie, and see how you can make improvements. The last one, and I do apologize you can't see this well, but it'll have a blue line in here that tells where you fall as far as the cost range between, and this one will have one right there in the acceptable range, but you'll be able to see that a lot better when you pull up your reports in the portal. The last section on this page is the key utilization metrics. This one is the surgical pathology utilization rate, and you will be in the darker blue and all other providers in the lighter blue, so you can see where your utilization metrics fall. The next slide is the next slide is the quality and utilization detail, and this shows the percentage of where you fall in relation to quality and utilization metrics. Notice the ones that are connected to Gain share will be highlighted in blue when you get your report. The last page of the report that we're going to look at is the cost detail. This will break down the cost categories associated with this episode of care, such as outpatient pharmacy, outpatient professional pharmacy, emergency department, inpatient facility. Looking at this, you'll be able to see where your highest costs are related to this episode, which will give you a better idea of where you fall in relation to other providers and where they're doing well and where you might have areas of improvement. There will be a glossary at the end of the report. There is also a detail section at the end of the report that will detail out your cost by beneficiary according to the cost detail. So you'll be able to see where you had high costs for each beneficiary, if you fell into that high cost category, or where you're doing well.